Hi, dear doctors. This is Dr. Mahindran J, Professor and Faculty of Forensic Medicine and Toxicology. I'm so excited and happy to interact with you through Marrow. Forensic medicine and toxicology. This is a subject which is taught during second proof and third proof. The total teaching hours as prescribed by NMC is 125 hours. And this subject is highly crucial for a PG aspirant and even for a doctor who practice in India. If you're a doctor who's practiced in India, you should know that most of the medico-legal work in India is done only by the non-forensic medicine expert, irrespective of the specialty. So a thorough and basic knowledge about forensic medicine is highly crucial in handling different medico-legal situations, following all the legal formalities and proper documentation. This is important for the benefit of the community, benefit of the patient, and for the benefit of the doctor himself. Right? You'll be aiding all the investigation procedures for the benefit of the community and the society. You will be doing safe ethical practice that is for the benefit of the patient, and you will know how to prevent and defend medical negligence cases that is for the benefit of the doctor himself. So this is the subject where we'll be dealing with the legal aspects of the medicine. Irrespective of the specialty, I told you, whether it be or in orthopedy, psychiatry, medicine, surgery, OBG, dermatology, whatever specialty that you might end up with, right? So this knowledge is highly vital. From a PG aspirant perspective, this subject is important. It will fetch you 10 to 12 marks. Irrespective of the exam that you appear for, be it INI-CET, NEET PG, FMG, whatever exam that you want to appear for, this subject is highly conceptual, logical, very easy to learn and understand. The amount of factual content is very, very less. Minimum pure forensic medicine, you will get at least 10 questions from forensic medicine and toxicology. And I have in my presentation, I focused on 2 C's. Number 1, concept. Number 2, I just wanted to keep it concise. Okay, I try to strike a balance between both C's, concepts and concise version. I have arranged the chapters as medical jurisprudence. This topic is very important. You need to know what are the ethical responsibilities of a practicing doctor in India. And Indian legal system, I guess forensic medicine is the only subject where you'll be learning about Indian legal system, the legal formalities that is followed in different, in various courts. Dermatology, I have used extensive images and illustrations. I have used various animations wherever it is needed so that you will understand it better. A basic knowledge about different kind of injuries, that is highly important. Be you're in surgery department, whether you are in casualty, you want to issue wound certificate, this basic knowledge about dermatology is highly crucial. This is where we put a solid foundation. Okay, and asphyxial death, I've given you a lot of case studies, and you can see toxicology is one topic which always students find it very difficult to study and retain. I've used a lot of images and case studies so that I just tried my best to make it interesting and palatable. You can see human identification, another important chapter, and forensic thanatology is again very important. You will not get any question paper without a question on forensic thanatology. I have arranged the topics in this sequence: dermatology, medical jurisprudence, Indian legal system, asphyxia and thanatology. All these subheadings have arranged videos. You can see that dermatology is high yield, medical jurisprudence high yield. The NMC would like to know before giving license to a PG aspirant as a registered medical practitioner whether the person is aware of all the legal and ethical responsibilities expected from him. Fine. And thanatology, I told you that is high yield. Toxicology is high yield because this toxicology, you will not get any question paper without at least 3 or 4 questions from toxicology. Okay, so these are all the topics which are high yield where you need to spend more focus. Okay, and you see this subject can be integrated in any subject. This questions on this particular topic can be integrated with any subject. OBG, you can have questions on impotency, virginity, pregnancy, delivery, sexual offences, examination of victim, examination of accused, issuing a drafting a wound certificate, drafting a death certificate, drafting a fitness certificate, leave certificate. All these are the basic competencies that are expected from a doctor. Suppose if you are studying in second prof MBBS, how can you plan the preparation? You need to start early. You can focus on the topics like medical jurisprudence, traumatology, toxicology, so that you will understand it better. You can apply it when you are getting early clinical exposure. Focus on the videos whenever possible. Always follow textbook, and you try to make your own notes because you have time here, sufficient time. Suppose if you have moved on to third prof, do remember you need to follow textbook, videos, and if you have already started making your notes in the second prof, you can continue with that. Otherwise, it's advisable that you follow the printed notes and you add points in addition to the printed notes. You need to solve question bank. If you are beyond third prof, like if you're in final year, intern or post intern, now the time constraint is very important factor that we need to keep in mind. Follow the videos, right? And most importantly, you can follow the printed notes and question bank. That is highly important. This is not only an assessment tool, this will definitely be helpful in your learning process as well, where you need to do grant test, subject-wise test, everything that you need to solve, and whatever extra point that you learn, you just translate it into that notes. Right, I do understand that if you're an intern or post intern, solving all the 19 subjects, learning all the 19 subjects in short duration is very difficult. Right, we know that because we were also in the same situation. But trust me, whatever hard work that you put in now, it will definitely be worth in the end. One day, the people will thank you that you did not give up now. So how can you plan your preparation? You can see, let us divide that into 3 phases: first phase, second phase, and third phase. Right, in the first phase, do remember, I just need your 5 to 6 days of time. You can solve the videos, you can revise, and you can solve all the question banks. You can go through the videos, you can revise, and you have to solve the question bank. If you are spending around 6 to 7 hours a day, right, you can watch all the videos and you try to revise the content which you seen on the same day itself. And I would prefer to solve the question bank on the subsequent day, the next day, so that you can find out how much that you're able to retain and how you're able to apply it. And see, there are 2 things that you need to add your notes from the question bank part. Right? Number 1, whatever mistakes that you make from solving the question bank, you need to translate it into the notes. Not only that, whatever extra edge, high yield points that you take it from the question bank, you need to translate that into notes. Okay? So if you're using this kind of 6 to 7 hours a day, like you should be able to complete within 5 to 6 days. That should be fine. And second phase of preparation, 2 months before the examination, I just need your 3 days of time so that you can revise whatever you've learned earlier. And remember, and the last month before the examination, I just need your 1 to 1.5 days time so that you will revise the final preparation. Fine. We have already given 3 revisions. You can see in the first phase itself, we have given 1 revision while you are solving while you are watching the videos and solving the question bank. And we have got second revision. We have also had the third revision. But do remember, the last week before the examination, make sure that you watch all the high yield images and the factual content, that is your legal sections. Right? Legal sections. Remember, many of the students, they find it difficult to remember all these legal sections. You don't have to do anything else, just comes by practice. Maybe like you can solve 5 sections a day in the last 2 months of preparation. By the end of 2 months, you'll be the expertise in solving all the questions about legal sections. Kindly do share your feedbacks or comments. If you have any academical queries, you can always approach the Facebook group Marrow Links, where I'll be available. I'll try to solve your query as early as possible. And if you have not joined it, you can join the Marrow Links group Facebook. And if you have any kind of personal query or you need any personal opinion, you can always feel free to approach my Insta profile, Dr. Mahendran JFMT. I have tried my best to make the subject conceptual, interesting, and high yield. I have given my best. I just want the same from you. Together, we can achieve your best result and your dream seat. Wish you all the best. My prayers and best wishes to you and your family. Happy learning.